So, Dr. Garza, today we wanted to kind of touch base with you about some CDC guidelines that were issued in the
Yeah,
last 24 hours regarding um, people who have received the vaccination and how they can congregate and meet
yeah,
in person. So, just want to get your take on that. And of course, you've been through a lot in this past 12 months dealing with. You must have had some frustrating moments with the pandemic and getting people to um, do the measures and guidelines. How is the vaccine changing how we should think about COVID?
yeah. So I think the way that the way that vaccine is changing the way we think about COVID is that obviously we've got a little bit more protection now in the community with people becoming vaccinated. So if you think about those populations that are getting vaccinated now, so the healthcare workers, first responders, and then the most vulnerable, which are the elderly and the people with chronic healthcare conditions. So if you think about who or what is the significant amount of people that show up in hospitals or that become really sick and potentially die from COVID, it's really that 1B2 population, or the elderly and the people with chronic medical conditions. So, part of the reason why we're seeing this dramatic decline in cases and in hospitalizations is because of that. So more of those people are becoming vaccinated, so they're not ending up in the hospital, they're not ending up in our intensive care units, and they're not dying from the disease. So I don't think we can underestimate the impact that has had. In addition to those mitigation strategies, so wearing masks, socially distancing, not gathering in groups, but the vaccine has had a tremendous impact, and it will continue to play out over the next course of many months.
The CDC guidelines have been a huge step forward in the relief effort of the pandemic.
Yeah.
Anything that you would share with us about that announcement?
Yeah, so I think the CDC is trying to balance more freedoms while still maintaining some vigilance. What they've decided is people that are fully vaccinated. So fully vaccinated means 2 weeks post that either the second shot for Moderna or Pfizer, or 2 weeks post that single shot from Johnson and Johnson. And so if you are fully vaccinated and you are around people that are fully vaccinated, then the CDC is saying you don't need to practice all those mitigation strategies, so wearing a mask or staying socially distanced. And then they get into some territory where they're trying to inject it's a little bit of common sense, but making people understand that all risk is not equal. And so if you're fully vaccinated and you're around people, presumably it'd be within your own household or close contacts that are at low risk from severe disease from COVID. So those are people that are otherwise healthy, no chronic medical conditions, things like that. Then again, you don't have to wear a mask or do the social distancing. However, if you're around people that do have an increased risk for severe disease, then you should still practice all of those mitigation strategies. And the reason for that is because there's still a small but plausible probability that a person who's vaccinated could still become infected and transmit disease. Now, that risk is very small, but it's not zero. And so that's why they're trying to thread the needle between balancing freedoms for people that have been vaccinated and those that are still waiting on getting vaccine.
I'd have two questions in response to that exactly. One is people who've been vaccinated will have access to interior spaces and stuff. How will we differentiate who's had the vaccine and who will not? We don't have a passport system or an readily identifiable situation. How do we manage that?
Yeah, so, and I think that what they were trying to convey is look, this shouldn't be for the being out in the general public. So they did say if you're out in the public, then you still need to follow all of those mitigation strategies for the fully vaccinated people. So you still need to practice social distancing, you still need to be wearing a mask. So that way, if you're around unfamiliar people or out in the public, that everybody is still acting the same. Now, the second part of that is a little bit more practical, but people do get those immunization cards that say, yes, I have been vaccinated, and this is the date, and this is the type of vaccine. So there is a, it's not a perfect system, but there is a way to determine if people have been vaccinated or not. And presumably people that are fully vaccinated aren't just going to be going around, sort of not flaunting the rules, but not paying attention to the rules. So, going into stores or restaurants and not wearing a mask, things like that. So hopefully people will still adhere to those guidelines, even though they've been fully vaccinated.
Governments are starting to lower the restrictions on businesses and opening up again. Do you think it's too soon to do that, or is the timing just right?
Yeah, there's always a balance with that. I do think that we need to take it as slow as we can until we have the virus suppressed low enough that the probability for a rebound is not great. And so, the small steps that the city and the county have taken, they just on their face, they're always going to be increasing the risk. But so then the question is it too much risk? And I think it's reasonable to say extend those hours out till midnight, or to allow a certain percentage more of people to be in gatherings, as long as they're still practicing the mitigation strategies. So those weren't huge leaps. I do think that we need to take it slow. We always need to be aware that there's still a virus out there. There's still those different variants out there, and we still have a significant amount of the population that needs to be vaccinated.
On variants, a lot of people are concerned. There are more than one out there, and they are in the United States. How concerned should people be once they're vaccinated about still getting sick with the variants?
Yeah, so it's still a possibility, although it's a lower possibility when they're vaccinated. So most of the research that has come out says, even though it doesn't perform as well against those variants, there still is some level of protection. So even though you may become ill, there's still a level of protection. So, but with that being said, I do think that we still need to be aware that these are circulating. Especially because there's a significant amount of people that are unvaccinated. But we have to wait and see how much protection these vaccines are imparting upon those variants. But everything up until now has looked pretty good about offering a level of protection. Certainly not as great as what they were intended to be, which was the dominant virus that's circulating right now, but there is some level of protection.
Cross-vaccination, is this even a thing? Can you receive a Moderna and a Johnson & Johnson, or any combination thereof, Pfizer, Moderna, AstraZeneca? Is that a thing, or?
Yeah, so the CDC is allowing that, but they really want it to be, an exception rather than the rule. So if somebody, say, got their original dose in, California or something like that, and then had to move suddenly to Missouri, could they get the Pfizer dose? So the CDC does allow it, although they don't recommend it. And then the other recent one that we've heard is if people got a first dose with either Moderna or Pfizer, that it's allowable to then get a second dose of Johnson & Johnson, since it's a single dose anyway. But again, not preferable, but still allowable.
Final question would be, facing summertime, looking forward to a time where people will be more outside and engaging, presumably back to in-person gatherings. Do you share with the president's optimism that by May, most Americans should have access to the vaccine, if not be already vaccinated? Is that a reasonable timeline? And how does that apply to Missouri?
So the way that I typically answer that is, I'm from Missouri. I was born and raised here, and so you got to show me. Now, the thing that we have to understand is, if the president is saying that there will be enough vaccine manufactured by May to be available to every citizen 18 years and older in the United States, that's a much different proposition than saying, and we will have it delivered, and we will have it in the arms of everybody by May. Because that's a huge logistics lift. So I do believe that production capacity is going to be increased enough so that we can have enough vaccine available for that population. So the 18 and older population in the United States. It still will take time for delivery and then for vaccination, because that is the time-consuming piece, is getting needles into arms. So, but I do think, though, given all of that, that by end of summer, mid-fall, that most people that do want a vaccine should be able to have access to vaccine and be vaccinated.
Very good. Is there anything I haven't asked you that you would like our audience to know about the ongoing efforts with the vaccine, or programs or plans that you're working on?
Vaccine will become more and more available. People will become more and more eligible for vaccine as well. And so as everybody, I think, knows, we're going to go to the tier 3 starting on Monday. The healthcare systems are still working with the most vulnerable populations, which is that 1B2, the 65 and older, and people with chronic medical conditions. But there are other vaccination sites that are going to be more focused on those tier 3 populations. So we're trying to work our way through everybody. It's all dependent upon vaccine delivery, but eventually that supply will meet demand, and we'll be able to get everybody vaccinated.